Hi, you finally did it. You purchased your Isolite and you got it installed. So, what's our next step? Well, the next step is you're going to go ahead, try the Isolite in on yourself, try it in on your assistant, on your staff members, and let them try it in on you. Because you want to get a feel for how the Isolite feels in your mouth before you put it in the patient's mouth. And you want to become proficient in the insertion of the Isolite into the mouth. Now it's time to get started and choose a procedure that will be beneficial to you. We can do crowns, we can do inlays or onlays, we can do fillings, be them amalgam fillings or composite fillings. We can extract teeth down here, we can do sealants down here, we could place implants down here. There's a lot of things that we can do as dentists that fall within a good standard of care when we got the appropriate isolation. Let's pick a quadrant and let's pick a procedure to get started on. I like to start in the lower right-hand quadrant. That's where the teeth are closest to me, and that's where I can see the best, and that's where I have some of my most challenging problems in trying to keep the tongue out of the way. So that's a good place to start. Let's go in and let's do something pretty simple to start with. Let's take a quadrant of old amalgams that need to come out and need to be replaced. Put the Isolite in, take out the old silver fillings. You'll be amazed at how well the Isolite evacuates the silver and the debris. And any little chips of fillings that come out there just kind of fall into the floor of the mouth or rest on the Isolite. And if your assistant is nearby, she can pick up the additional high-speed evacuator, put that in the patient's mouth, and just suck out these little tiny chips. The other thing that you're going to love about this, you can position the patient to where you see best. You're the dentist, and we have to be able to see what we're doing in order to do a good job. So have the patient turn towards you. Ergonomically, this will make it a lot easier for you. You'll be much more comfortable when you're working. Now you're going to see the benefit of the Isolite because 1, the tongue will be out of the way, 2, the cheek will be retracted, and 3, everything will be evacuated and aspirated for you. Your assistant is going to find the benefits of this because she's not going to have to be leaning over, retracting the tongue, and evacuating the saliva and all the debris that's coming out. So she's really going to understand the benefits, and at the end of the day, her job is going to be a whole lot easier. And you know what? At the end of the day, so will yours, because your back won't hurt, your neck won't hurt, and you'll literally be done ahead of schedule because the Isolite allows you to finish your procedures about 25 to 30% faster. Add that up throughout a day, and you've got a good hour savings at the end of the day. Dismiss to the corner of the mouth, gently fold the cheek protector forward and slide the isthmus area into the buccal vestibule, and then you gently pull back the bite block onto the biting surfaces of the left-hand side and tuck it in, and we're ready to go. So now we're going to go ahead and begin number 30 and 31. Vacuum on, please. As we're removing the silver, all the silver is aspirated up.
Actually, I have this the second time that they've used Isolite here. The first time was with my tooth cleaning, and what I noticed then and I noticed today is that it's much more comfortable to be in the chair. I don't have to worry about, is my mouth open far enough? I don't have to worry about my tongue always getting in the way. It makes it much easier to just relax and allow the dental work to go more smoothly.